Check, check, check. Thank you. Appreciate that. Okay,
And
welcome. Go ahead.
Okay, we'll have IT. You can go ahead and start, Craig.
Good to go.
Okay, so I'm welcoming everyone to the February 22nd meeting of the McLean County Health Department's Mental Health Advisory Board. And very happy that we have a quorum. Thank you for joining us. It feels, in some ways, it feels like we were just together, and in other ways, it feels like it's been ages because a lot has happened between September 25th and today. Many pretty world events, and new president, new vaccine hope, new vaccine frustrations, etc. But anyway, welcome, and we will go ahead and do the roll call. And Amy, are you going to do that?
Yes. We have, let me go down the list. Sharon Fitzer. I don't think she's with us. Gabby Bonte.
I'm here.
Brian Moore. Trisha Malott. Martha Dittmer let me know that she wouldn't be able to join us. Mary Campbell.
Here.
Dan Deneen. I know Dan's with us. He was just talking. Lori Walrab.
Here.
Faye Freeman Smith.
Here.
Chief Rick Fleischner.
Here.
Dr. Christine Strauss. I know she's also with us. She's on the phone. But if you are talking, Christine, we can't hear you. And Corey Tello.
Yes, here. Okay.
And then we also have Taylor Davis, the behavioral health specialist for the behavioral. Oh, Trisha is here. Just sorry, I didn't hear you say here.
I just jumped on.
Okay, perfect. Taylor Davis is the behavioral health specialist at the health department.
Okay, very good. So do we have any members of the public? I don't believe we do at this point. So
No, there's no public participation.
Okay. All right. So we thought that it would be the best use of our time today because we want to spend a lot of time in having you give us input for kind of strategic planning. So we thought the best way to give you just an update on anything related to human services or upcoming events or things would be to give that to you in writing. So obviously in your packet, you have information about the remodeled behavioral health unit at Carle, a path update about their statistics. You've got great information that Trisha provided us about Fuse and Triage Center and the Mental Health Action Plan and the Behavioral Health Community Forum and the Countywide Trauma Informed and Resilient Initiative. And I've got a couple other updates, but before we talk about anything else, is there any questions you have about any of those things that were in the packet? Or do you have any questions for Trisha? Because she's kind of at the center of much of this.
Hey, Corey, can I make a suggestion real quick before we get into that? Can we go ahead, because I know a couple people said that they have to jump off early. Can we go ahead and approve last meeting's minutes so that we get those approved before we jump off? Thank you.
Yeah, we might want to always move that to the beginning of the meeting just for that same purpose. Maybe that's always a good idea. So, all right, if everyone will join with me in the minutes from September 25th, 2020. If there are, do I have a motion to approve those minutes?
I'll move to approve.
Okay, so Lori Woolrab, I saw her, so we'll say, and Mary, you second then, is that okay? All right, very good. So Lori Woolrab and Mary Campbell, first and second. Any comments or additions, questions?
I would only add that those are the most detailed minutes I've ever seen in my life.
Yeah. It was really helpful because when our meetings, there's so much time in between our meetings, it's really helpful to have that kind of a good review. And,
Yeah.
and things I want to mention about that when we're done here, but so seeing no one adding or deleting anything, all those in favor of approving the minutes, raise your.
Gloria, I think we need a roll call vote on
Oh,
item.
that's right. I keep forgetting that we have to do that virtually. Forgive me. Okay, so we will do a roll call on approving the minutes.
Gabby Bonte, and I saw in chat that she approved, said aye. Trisha Malott,
Aye.
Mary Campbell,
Aye.
Dan Deneen,
Aye.
Lori Walrath,
Yes.
Faye Freeman Smith,
Aye.
Rick Bleichner,
Aye.
Christine Strauss, and then Corey Tello.
Aye. Okay, thank you for that. Motion carries, obviously. Okay, so I just wanted to mention, because there were so many mentions in those minutes about mental health advisory, or I'm sorry, mental health first aid. I wanted to give you an update on that because we had said that, we thought that some of the things going forward that we should be looking at our for marketing and training and everything included mental health first aid. And I did just want you to know, if you didn't already know, that at the November 18th Board of Health meeting, the Board of Health did approve $12,900 to go to mental health first aid. And part of that was to share with the Central Illinois Area Health Education Center to blend their monies with our $12,900 and do a trainer of trainers training. So in other words, bring in someone to do a training for people that will be ongoing trainers for mental health first aid, because we had, as a community, lost some of the trainers. So I do not believe that has happened yet, but I know that they are working on that. And again, that was part of the money to make that happen, because obviously we have to have a decent number of trainers to be able to widely offer both the mental health first aid for adults and mental health first aid for youth. That money, in addition to doing that trainer of trainers training, is also to pay for manuals and training materials, so that anyone who gets trained, not who's going to become a trainer, but who actually is going to be someone who is a recipient of the training, that they will only have to pay no more than $12. And I do believe there's even a way that scholarships are awarded so people can attend if necessary for nothing. But we wanted to make sure those costs for that training were really driven down. There was a mental health first aid training offered by the Mental Health First Aid Collaborative on January 21st. And so we are happy about that. I am not yet aware of when the next one is, but I know that the collaborative is working on a calendar. Obviously, there are challenges because of the fact that, it has to be hybrid or virtual still. And so that required people to, do it kind of differently. So anyway, but that, I just wanted you to know that your words to us to say that was a priority did definitely get heard and moved and acted upon. Also at that November 18th Board of Health meeting, the board approved $4,000 to do continued marketing and advertising, as obviously you remember at our September 25th meeting, we talked a lot about that, as you probably also remember, we were going to widely market 211 because we felt so strongly that, that sometimes the people who maybe had been most negatively impacted by all of the converging crises were not the ones that always knew about or were accessing 211. And so we wanted to really blitz the community, and particularly certain areas, with that message. And then we kind of backed off because we had heard from PATH that they were getting such an increase in call volume that there was a concern that if we blitzed and they were not able to answer the calls, as quickly, as possible that could be problematic. So we have been, and when I say we, I'm just kind of saying the Board of Health and others have been just staying in really close touch with PATH about how their numbers are. And that's why you had a lot of statistics in your packet about where PATH is right now. They continue to tell us that they feel like they are still able to, keep taking on calls, and that they, and they're closely monitoring, like if they have a little bit more delay in answering, typically they're really monitoring that closely. But you see that definitely the increase is remaining. And for a while, they had a lot of calls related to just the vaccination process. And we're hoping that as things are getting smoother with that will take less of their time. They also, as you know, started a text line, but that's kind of still considered to be kind of a, it's up and going, but they're still doing that. I think they're still monitoring that very carefully and not blitzing the community with that information until they get all the bugs worked out of that. And I did try it the other day myself just to see how it went. And so I texted to the number that you basically text your zip code to, I believe, to a number. And then, and what I found is that I did not get a response back for several hours. So, I think and again, I think if it was, if you're just looking for support and then it tells you that you'll be contacted at a certain time. And so I definitely got a response back within the same day, but it definitely is not really quick. So just wanted to make sure people understand that. And I know they're working really hard on getting that going because they assume that's going to be very popular once it can be maybe a little bit more immediate. So now I'm going to stop and back up and say, are there any other questions about any of the updates that were provided in the packet? Okay, and then I would also ask, do you have any updates? Do any of you have updates you'd like to share? Lori, and I'd like you to talk about the sustainability piece too, Lori, at some point. Go ahead.
A couple things. I think I might make a suggestion concerning some of the statistics that are in here from our own center, where maybe it would be possible to display those in a bar graph. Maybe I think it would make a little more impact, and I think we could track that easier over a number of years, hopefully. So.
Very good. Thank you.
And then I guess the update I would have is that the McLean County, you probably know this, all of you, McLean County Board approved giving PATH some funding out of money that was originally earmarked or designated for the business community. And those what had been loans weren't moving as fast as we had hoped, but so we had money in a pot that had been sitting there literally for years, and I believe the figure was $46,000 or $48,000 towards needs for homeless population right now because of the closed centers. There's a need for funding to put people, I think it was in motels. So I think that was not sure that was in there.
It was not. Thank you. That's a very important piece and a very needed piece. And and thank you. And that reminded me, I should mention that the part of the $553 also funded some monies for PATH, which were to allow them to hire an additional supervisor to definitely cover the evening hours, since again, to help. Obviously, when you have more people that are newly trained, you need more supervision. And also when the kinds of calls that are coming in, the acuity of the calls is greater, you really want to have supervisors present 24/7. And so that allowed them to do that. So I do love that our community has really put their arms around PATH because it is such an important hub of everything. So, okay, thanks for that, Lori. Mary, you wanted to share something, I think.
No,
No, you did not.
No.
Okay. Okay.
I do have a question that I would follow up with Lori's comment. I keep hearing that the shelters are closed. What does that actually mean? And is it all just COVID related, or are they closed? Are they just not taking new people? I mean, I've talked to a homeless person recently, and that's what they told me too. So does anyone know the status of our 2 facilities?
This is Gabby from Safe Harbor. I can answer as far as what our policies have been at our shelter. I'm not really familiar with Home Sweet Home. But we have recently had an outbreak, and we've been working with Chestnut and PATH and the health department to quarantine those individuals pretty much immediately. But with that, so we continue to do testing, and we've had a few, kind of more isolated, 1 or 2 more positives. So with that, we don't want to risk new populations coming in and having, we want to prevent them from getting COVID if we identify that as being in our building. So we've just had a testing day last Friday, and we're still waiting for the results to come back in. Hopefully we'll get those today. But if that last batch reveals negative results, we will look to kind of evaluate and let people back in. But we're going to do that with them getting the clearance card, so background check, but as well as getting a COVID test before coming, and then still having the ongoing testing with Chestnut coming on site. So that was the reason why we've had to limit our numbers coming in, and just kind of put a pause on that.
So Gabby, how many are you currently serving? So you still served some, but obviously much less. So how many are you currently serving?
Roughly about 35 to 40 individuals.
Okay.
And then we've also had to create distance between beds, and it being a bay, the only way to do that is to block out some beds, because the beds are 2 feet from one another. So even if we do open up, we can't have the full amount that we used to. I mean, in the previous months, we were always at maybe 120 to 30% over capacity. And with that, we had as many people as we can fit in the building, down the hallways, in our cafeteria, in our lobby. So it's very different and hard for us to know that there is a need. The need hasn't changed. If not, the need has increased. But we've had to, turn people away.
Yes. So what was your maximum capacity?
So our beds were 56 or 58.
56.
But like I said, we'd be over capacity when we're utilizing the hallways and cafeteria and lobby area, pulling out cots and mattresses to just house additional people.
Okay. Well, we thank you for that, and we're very sorry, and we hope you get really good results and they can move back, because, oh my gosh, and of course last week was brutal for people. So
Yeah.
Did you have any, thank you. Thanks for filling us in, Gabby. Tricia, did you have anything else you wanted to say about that? And did you know anything about Home Sweet Home?
My understanding had been that they were open, that their capacity had been more limited. And that was as of the end of last week, I think. But I wasn't aware about the outbreak at Safe Harbor. And so things can also change so quickly. But I think it's just been reduced capacity over at Home Sweet Home.
And if you noted when you read the statistics from PATH, they said in January of 20, they had 65 calls related to homelessness, compared to January 21, where they had 140. And he said it was, of course, mostly due to Salvation Army Safe Harbor being closed due to, or, largely minimized due to the outbreak. So yeah, and I know they've worked hard to find alternative places, and I'm sure that's been tough. So obviously something we need to keep an eye on. Okay. Let's see, the other thing, so did anybody else have any other updates? And I don't know, Chief Fleischner, do you have anything anything interesting from your vantage point that we should know about?
Well, I don't know what you would classify as interesting. It all becomes kind of
Yeah, like,
pretty routine after a while. But
okay,
no, at this point, I mean, again, just from our purposes, we're just trying to keep staff as safe as possible. And we have seen an increase in 2020, obviously, in our mental health calls. Our domestic violence calls were upticking, especially at the beginning of the pandemic, but then kind of leveled off and ended up the year pretty consistent with past years. So our real focus for the year is just kind of making sure that we've got good connections and resources to help and assist people that are still struggling, obviously, as COVID goes on, homelessness, and then we're also working through some opportunities for building and enhancing officer wellness and resilience, because our staff are people too, right? I mean, they're going through what everybody else is going through and seeing this, and we understand we're fortunate, but we're human too. So we're just kind of looking at how we can increase that, and through either some peer support or building, connections with some other agencies that we might be able to have some mental wellness checks and different things like that. So
very good. Yeah, we've got to keep those first responders healthy so that they can help everybody else. That's very important. The other thing that I wanted to mention, and that was, I don't know how many of you paid attention to the governor's budget address on, was it Friday? And the Illinois Association for Behavioral Health, Amy shared this. They kind of did an update from his address. And again, that was his proposed budget. So this is not finalized at all, but based on the analysis of his address, it looks like he's recommending a net increase for the Department of Human Services of 11.3%. So that was encouraging, and an increase of 3% for the Department of Mental Health. And he also earmarked, again, if it all passes, $22 million for behavioral health special projects. And that is a doubling of the 11 million that was earmarked in 21. So, I think there was a real acknowledgement that we know that the behavioral health crisis is real and needs to be addressed. And then there was also there was a 23% related increase in expenses related to the substance use prevention and recovery thing. So we will see how that all tracks out. But I was happy to know that there is that recognition. Tricia, did you have anything about that you wanted to add, or okay?
No, I got a similar update, and I agree with you. I found it really promising that it's proposed to be an increase, because in past, we all know in past years when the state hasn't been doing well financially, social services tend to get cut. And so I was really pleasantly surprised to see some of the state agency updates that I got, that it's proposed to be increased. So
very good, very good. And the other piece of good news, and you probably saw this in the panagraph, that I believe it was in December, early December, that they announced that District 87 got a pilot mental health grant, a $1.5 million grant for 5 years. And it's to kind of build systems and capacity in using community linkages to provide mental health behavioral supports for kids and staff. So staff get the training they need to better support staff, or better support the students and families. So that's going to be, and I love that it's 5 years, because as we all know, things have to take a long time before they are fully operational and become sustainable. So I'm excited to see where that's going to go. Okay, and I think that's it. Other than you probably all also know, tonight there is a virtual town hall on vaccination safety, vaccine facts, I should say. And that really came out of, whether you know it or not, you all were instrumental in that town hall coming about. And I'll explain that. And then that'll take us right into the, again, in your packet, hopefully you have in front of you your mental health advisory board discussion guide that we're going to go through. But again, what really happened about this town hall came out of, as this group talked about needing to reach out to Black and Brown communities and just any community that has been, disparities exist for, that Judy Buchanan and I did reach out to and got a linkage with the NAACP Health Committee that's chaired by Arlene Jose, and ended up working with a little group and we really at that point weren't working so much as health board members. We were just kind of working as citizens and got involved in what we kind of later dubbed the Health Equity Community Task Force. And what our first charge was, what we thought we were going to do was start talking about 211 and getting that messaging out. And then some of you would have been, it would have been a more official committee that would have been, and some of you would have been brought on board with that. But we ended up, because the vaccine suddenly appeared on the horizon. And so we all just said, the very first priority we need to do for the Black and Brown community really is to make sure they understand that the vaccine is safe for them and that they have reason to trust it, because of, as we all know, a history of them not having reason to trust things that are health related. And so anyway, that task force just has worked, and we've got, and tonight at 5:30, there is if you haven't already seen the flyer, we'll make sure you get it. But there will be 4 local doctors of color that will be talking, as well as a more formal presentation about just educational piece. So we're happy that has happened. And what I think the next steps are, we have to really go back to the table and figure out, where do we now go and get us back to this marketing idea that we talked about so much in our September 25th meeting, and make it official, bring back some of you who were on that committee and see where we go next. And I know we need to have a conversation about that back with the health board and everything, but we haven't lost that. Believe me, we haven't lost sight of everything we talked about in those minutes. And we'll be involving some of you in next steps. The other good news is, I don't know if any of you yet have met Marianne Manco, but Marianne Manco is a new hire at the health department. She is the public information coordinator, and we are very, very happy to have her, because boy, when we start talking about marketing and advertising, she's exactly who we need to be able to, pull some of that together. And she's got some really good experiences and skills that we can really use to help us move this forward. So I wanted to let you know about that. So any questions about any of that or comments? Okay. Okay, well then let's jump right into the discussion guide. And I hope you have that in front of you to look at. And I hope we're just going to spend some time, and this is just picking your brains again, because as you know, every year as we start the process looking at how $553 are going to be spent, we really need to identify, we know we always talk about there's certain core services that we know have to be funded. And with limited dollars, often much of those dollars have to go for those core services like adult psychiatric and crisis, mobile crisis, and all of those things. But we still want to make sure we have robust thinking about this So we can look at it from lots of different ways. And I again, one of your roles as the Mental Health Advisory Board is to help the health department with their strategic thinking. And I know, again, Tricia, I keep putting you on the spot, but I think BHCC is kind of looking at your kind of strategic thinking too as well, right? So go ahead.
Yeah. Well, and I mean, this was in the update, but Chairman McIntyre had requested that Susan Schaefer begin updating and revising the Mental Health Action Plan since it's now we're now in year 6 since it was first approved. And so, yes, that paired with the Trauma-Informed and Resilience-Oriented Initiative, there's a little bit of overlap between the two, but there is a lot of sort of strategic planning happening under the umbrella of BHCC in a few different areas. So
yeah. So my hope always is that all of these things integrate, and I think it's always good too to find out what United Way is thinking. Like, are they changing their priorities? Also, what is John M. Scott Healthcare Commission? Where are they? Like, what their priorities? So, I mean, I just think we're so much wiser if we look at this very comprehensively across all systems, and that we all share and prioritize together. So that's always the goal. And I don't know if anybody here is connected to either United Way or John M. Scott and has any words of information about either of those. Okay. All right. So let's go ahead and, again, I'm just really eager to hear your input on some of these ideas. And so, again, just looking at item number 1 there on the discussion guide, just from what you live with every day in your arena, what 2 or 3 needs are you seeing that should be prioritized? And they could be either existing needs that just obviously still need to be right there at the top, or they could be something that have kind of newly sprung forward. So,
Hey, Corey, it's Christine. How are you?
I'm good. Hi, Christine.
Hi. I'm going to remain consistent with my same need that I talked about last year, people coming out of IDOC, as well as the county jails still needing some of that transitional psychiatric and psychological services for their continuity of care.
Thank you. And has there been any funding allocated for that at all? How's that, and how's the budget looking for IDOC?
From IDOC, no, they don't pay for adult services. The only thing that the government pays for psychiatric and psychological services are for the Illinois Department of Juvenile Justice. So that would be for adolescents coming out of the institution. But
Okay.
adults don't get the services paid for.
Okay, thank you. So again, transitioning psych services, and I think you said something else besides psych, but obviously everything related to getting them to transition successfully back into the community from jail.
Correct. Specifically psychiatric services and any psychological services that
Okay.
would facilitate continuity of care out from the institution, whether it be a county jail or a state facility, out into the community.
Okay, thank you so much. I appreciate that. Okay.
I would echo that's a topic that's been brought up in a recent book that's been highlighted by New York Times called Waiting for an Echo, that it's kind of like there's an on-off switch where you're in the totally controlled prison environment, and then within days you're thrown into the community. And the readjustment, and Scandinavian and other countries do work on the transformation. And don't you, especially of course, if you're going from, one of the more severe prisons to, where everything is controlled and noisy, everything else is just disorienting, and that there is no transformation. So I'll be adding something later beyond this discussion relating to the general topic, but I would agree that especially in the need, I mean, you talk about psychiatric services, that's the most important and key to this group, but just lifestyle changes are disorienting also, and there is no transition coming from IDOC and no money coming to the communities to help the people transition, and basically setting a lot of people up for failure.
Thank you. Thank you.
And I also agree with Rick and Dr. Strauss about the need for more funding. The transformation from prison to community is there is none. So I guess we need to look at some models. You mentioned, Rick, about some models over in Europe, et cetera. Maybe we can look at some models and successfully look at how we can create more transition detail and helps, because yeah, I agree that that is limited in our community.
Thank you, Faye. So Lori, I'm going to put you on the spot as the county board member. So I know the county board has a justice committee. Do you know if that's something that they are looking at, or, I mean, is that something
no.
that should involve them in this piece?
Currently on the Justice Committee, but I can say that I have not heard anybody ever speak to that in my time on the county board. But that doesn't mean it hasn't been talked about. I certainly could talk to some of the county board members, but really it's an oversight committee, and we don't really have funding to apportion to something like that. So I'm, if there's some, and unfortunately, we have no way to impact how the sheriff runs his organization or the jail. It's completely under his control, other than to take money away from him, I suppose, which we probably wouldn't do. But secondarily, it's just, yeah, there just is no funding allotted. But I think, people might, there's the Criminal Justice Coordinating Committee that mostly works, and I believe recently they're still doing this, working to reduce prison population, but that doesn't address the needs you're discussing. So the only time I remember a transitions issue coming up has been quite a number of years ago, when it had to do with people being released from the jail, being able to get access to their medications right away. There was issue with that, and the county board got involved in that problem.
Yeah, yeah. Okay. Thank you. I appreciate that. Okay. Anyone else? So we obviously identified one critical issue that there's some real consensus around. What else?
Mine is more of a question, because I don't really operate in any direct care space, but I've been wondering whether, with the increase in homelessness that apparently we're seeing, or the needs addressed with people being able to keep their homes or their their spaces where they're living, and also the food, the people having difficulty feeding their families in some cases now, whether that's creating additional stress, I would imagine it would be on people, and whether, is there something targeted particularly to that? And then also in that, more or less that same vein, with the populations, the Black and brown populations, assuming that that's hitting harder there, as I understand it is, is there more reach out going on to those populations to help them deal with the effects of homelessness, or, trying to get people settled and that kind of thing?
Mm-hmm.
I would add to the issue about reintegration. I guess when you're in the county jail, you're generally not there for more than a year. You have to move on to a state facility. But so maybe the issue of reintegration is less impactful when they're there for a short time. However, and I don't think we have any control over. We have a former foster son who I think Corey will remember.
I sure do.
Whose alcoholism with 2 DUIs has landed him in a state facility, and he calls in once a week probably. It's the craziest situation, and I suspect COVID has a lot to do with it. But you have, in his case, men being housed with absolutely nothing to do for days and weeks and months on end, and they just, I mean, he tries to find jobs like cleaning up the laundry area, but they keep moving them. And I guess he doesn't know because they don't tell them what the reasons are for things, but they move them from one part of the building to another part of the building. It's just, if anyone was emotionally unstable, or if anyone was emotionally stable, they are not going to be when they leave that facility. They aren't. It would drive all of us to the brink.
Mhm.
So I don't know what the conditions are. I don't know why it's this bad. I don't know if it's always this bad. I wish Sharon Fitzer was on here to address what they're doing for women. But I would say, based on what I do know, the conditions have dramatically deteriorated for the incarceration of people. And so, and actually, there's another one to follow up is he has a fellow that he sort of made friends with who was he had an out date, but he couldn't find a place to go. So Joey asked me to look around, could I find something? And so, boy, the numbers of places where someone can reintegrate to are abysmal. I mean, there was one place in Springfield. We have a sort of a place here in town through Eddie Perkins Project. Then it's Chicago. I mean, that's it, pretty much. So there are not a lot of options for them. And so they return to the same problem area that they came from. And then we reincarcerate them again. So I don't know. That's just the global picture, but I don't know if there's no services. Let me just say that there is no, he's asked and asked. He knows he has a drinking problem. He's asked and asked for help. And there's nothing. There was nothing when he was in the county jail, and there's nothing now. And he's been there almost a year.
I'm so sorry to hear that. And so, I mean, and again, as he represents obviously many, many more. So that is horrible, horrible, horrible. Go ahead, Amy.
So just to speak to what Mary's talking about, so during COVID, there's a lot more where they're put on lockdown because they're trying to not spread the virus. And so like when I worked in IDOC, there could be like 3-4 days, like with flu season or any other type of issue where they would put them on lockdown and they have to stay in their cells. Their food is delivered to them. And so, and then even after those short period of times when they would come off of lockdown and we would have to do group or interact and try to engage, even after that amount of time, it was very, very rough for them. But with the virus now, there's just a lot more. Those lockdowns are a lot lengthier because they're trying to, and some of the prisons like have had outbreaks. And so then they're in deaths from COVID. So then they're trying to prevent that. But then like what you're saying, also what other people are saying, then that just creates how much like emotional and mental health damage is that creating from them being in that situation and being isolated. And then some of the DOC have programs and then some don't have specific programs. And so for someone it can be tough to try to like move around for an offender from like a prison to try to get programming because others are trying to get programming. And then some prisons won't take you depending on your background. So I think just kind of like reinforcing, like these are all reasons why. So DOC is not going to provide anything on the outside once they're gone. And if they don't find like DOC, if they don't find housing, they just keep them until they max out. So they wouldn't be put on parole. And so then when they leave, like they're just not DOC's problem anymore. They're not on parole and they're gone. So it just echoes like why it is really important. Like it's put on the community to help with those transitions.
Okay,
and
thank
going
you.
around,
Go ahead, Lori.
sorry, going along with what Lori had mentioned earlier about the committee that she's on, or previously when it's been discussed about reduction in the recidivism rate for the Illinois Department of Corrections, that's absolutely.
Christine, you fade in and out. I'm not sure why, but hopefully you can try it again so we can hear you better.
Sorry, I don't know why it does that on this platform. Can you hear me now?
Yeah, you're still fading in and out. So
Okay.
sorry.
All right.
But
Well,
go
I'll just
ahead.
type it. I'll type it.
Christine, you're on mute now, or we can't hear you if you're still trying to talk.
Yeah, because we definitely want to hear what you
No,
have to say.
I had shut it off. Is that better? A little bit?
A little
Okay.
bit. Yeah, just go ahead.
Lori had mentioned a reduction of recidivism at a previous committee that she was on for the population for IDOC, something that you had discussed on the county board, I believe you said, Lori. And you had said that it wasn't related to currently what we were discussing, and it's absolutely correlated to what we're discussing about if we don't get them services within the community, whether they're jail or IDOC population, they are going to have higher recidivism rates back into the correctional population. So
Right.
If that committee had discussed the reduction of IDOC or institutional, any type of correction, then it is absolutely related to exactly what we're talking about. So I think that was good work that Lori were doing previously, that hopefully we can start to revisit that again, because as Amy said, this is a community issue. This is not it's not a jail issue or an IDOC issue, if that makes sense.
Right. And on question number 5 on our discussion guide is what groups could be collaborating more fully to address solutions. And so I think your point is good, Christine. And again, Lori, maybe this is something that, again, this is something that strategically needs to be looked at from the Criminal Justice Coordinating Council, and from, any other justice committee that's working in this community. And I guess, I don't know, BHCC, does that make sense that BHCC enters into this also, Tricia? I never quite know where.
Yeah, I think there's an overlap. I mean, so I would say I think it's an overlap between BHCC and CJCC. And we have a few people who do intersect both systems. And so I also serve on CJCC. And we have Judge Foley on BHCC and former Judge Rob, who has retired. And so she also serves on BHCC. So I think I actually made myself a note to bring it up to Will. So Will Scanlon plans and helps create the agenda for CJCC meetings. So I made myself a note to bring it up to him. And so I'll contact him and Judge Feldheimer to see if it can at least maybe be a discussion at our next meeting. The only thing to know is there's not funding that falls under CJCC specifically. And so some of this also then becomes a funding issue. The one thing I would say though is that there are times that BJA or SAMHSA issue specific grants that really kind of address this. There was one I know a couple of years ago, and it was more on a local jail reintegration level. And I had talked to the sheriff and to jail staff, and at that time, this was a couple of years ago, they didn't feel like there was a need for what was being proposed and given the exact model that was being suggested in that. But that doesn't mean that needs haven't shifted or that opinions haven't changed. And so while I don't know of a grant right now that's available that fits what we're talking about, I do know that similar types of things have come out in the past. And so I think it just means keeping our eyes open, and if one comes up, then we figure out who can help address that need to write that grant and potentially get funding. So
very good. Thank you. Appreciate that. Okay.
I have a question for Mary concerning the situation she described, where you said, Mary, there was no help in the county jail for that situation. I was just wondering was about the access to the specialty courts, and was that pursued at all? And
Yeah, he, it was his second DUI, so he really didn't, qualify for those special services. He had probably the most amazing public defender I've ever run into, but, who worked tirelessly to represent him and tried all of the avenues that he could. But, you know, it just didn't work out. You know, and this kind of goes along with Dan's comment about his book that I wrote down the title I have to read. But in a way, it's almost like the community, and I'll just mean ours, but I'll take ours for example. Our community actually, in many ways, supports the continuation of the money that ends up going to the criminal justice prison system. Because what we do is we make sure. It's kind of like Detroit has planned obsolescence built into us buying cars, right? So they're not going to make a car that's going to last and be successful for a long period of time because they want it to fall apart and they want us to buy a new one. And in this case, what we do is we make absolutely sure that they're not going to be successful when they return to their community. And of course, then they're not, and then we send them back. So it's kind of like the community becomes the bridge back to the criminal justice system because of the way we operate. And, you know, I don't want to assume that there's any collusion there. It's just the way we operate. And
Well, it's like it's a wait to fail model, just like schools used to be before they started doing some of the more proactive, you know, catching academic problems early. Yeah, right.
Absolutely.
Yeah. So, well, so noted. This is, I think clearly this is, like I said, a consensus issue here. So I appreciate that very much. And I appreciate you, Tricia, bringing it forward to some people that would have some real expertise in that. So we will certainly be circling back to that. And thank you. Are there other needs that have really, that kind of were always there and just have heightened, or again, new ones? Go ahead, Amy.
I just wanted to add to, I think it was Lori mentioning earlier about homelessness, and then with COVID-19, the increase in unemployment and others, you know, that probably wouldn't have been in a situation that they may be homeless or now could be put in a situation of being homeless, or even just having, and I think sometimes when we think of homelessness, we think of like, oh, people living on the street. But if you don't have a stable address and you're going from home to home or staying with friends, like that is technically considered homelessness also, just not having stable housing. But I just wanted to bring up that I know that there was some actions put into place to, and I don't know if it was Illinois level or federal level, to not allow eviction during this time. But however, according to like what I've heard in trainings and some updated articles and stuff, is that those people, like those housing payments, if they're not paying them or they're not paying them on time, like the landlord is still like, that's just continuing to add. So even if they can't evict that person for a year, if they don't make any payments on their rent, their rent for a year, once that policy or whatever it is lifted off, and they're like, now if your person isn't up to date, your renter isn't up to date, you can evict them. We're going to see a huge increase in evictions when that happens, because who can afford paying a year of rent, or they weren't able to keep up, or they can't get loans. And so that's, and of course, like how that affects the community and people's mental health. And we know like for children and adults, stable housing it's a need on the hierarchy of needs. It's the lowest need that there is. And we can't function in other mental health ways. Not even thriving, we can't even function. So I think that's, I just want to add to that. And then just as a side note too, just to make sure everybody saw, Gabby Bonte did put in chat that homeless and elderly populations was something that she also wanted to further discuss or to be noted.
Thank you. See, seniors are definitely one of those populations that we've got to do more about. Thank you so much for all that. I guess the other thing that we knew that was going on is United Way, had really, when the pandemic first hit, they had done a huge thing about, food distribution. And I believe that's still going on. Am I correct on that? Does anybody know differently? I mean, it's not obviously going on to the extent that it was, but I believe there is still a lot of work with Midwest Food Bank to keep foods going out.
I think, Corey, there is still food going out, but they've shifted their emphasis toward what Amy brought up, which is homelessness.
Mm-hmm.
And so they're working their solicitation of funds and sort of being a hub of distribution is more related to homelessness right now. And I'm on another committee with Prairie State Legal Services, and that seems to be the point for which the conduit to connect people to the funds. And they don't want them going to each different agency to apply, because agency A may be out, agency then sent to B, and they're out. So they're trying to funnel it through. And I think the last thing I heard was they wanted them to call 211 to get the ball rolling.
Yeah.
So there are efforts being made, because Amy's correct. When when they say it hits the fan, it's going to hit the fan really bad. And of course, you have a lot of concern for the landlords. I mean, they have to pay their mortgage payments, and they have to pay their employees. So there's two sides to that. But when this is taken off, it's going to be a real devastating issue across the country.
Absolutely. And it's going to be a mental health issue, but it's also going to be a life or death issue. I mean, something that drove this home to me so much was hearing about people that have to wear CPAP machines, and they're sleeping in their cars trying to keep their CPAP machine, working. And I just can't even wrap my head around that. And so yeah, this is it's crisis. So I think everybody knows what Mary's talking about. It's that housing alliance that came together, and it's what Bloomington Housing Authority, Mid-Central Community Action, PATH, United Way, and there was another organization too. It's like 4 or 5 organizations that you're right, and they created it. So there's one form that you fill out, and it works for every agency, and there's kind of no wrong door. And you're right, it's just like shared funding, and that's been up and operational for quite a while. So, but again, there's only so many dollars to be passed out. But so anyway, very good. And again, I'm going to throw that back to you again. Are there any other organizations, like when we talk about groups collaborating around the homeless issue? Is there any other groups we can think of other than the ones I just named? Because I know the groups that kind of have that as their mission are already very much in a collaborative arrangement. But does anybody know of any others that we should be noting?
Well, Project Oz works with the youth.
Yes. Thank you, Faye.
Prairie State Legal.
Thank you. And I didn't remember them being part of that collaborative, but they must be. If you're what you just described, Mary, they obviously are. So that's great. Okay, but thank you about the Project Oz, Faye. That's important for the youth piece of it. Yeah. Okay. All right, others. We are doing a great job. I knew we would. I knew the problems are front and center. Are there other needs that we should be prioritizing other than transitioning back and from jail and homelessness?
I would say
Sorry, go ahead.
Okay, I'm out suicide.
And then Rick. Okay.
Increased on campus for Heartland. I had to bow out of just a half an hour ago because another issue of possible suicide. So I know that more money is going toward 211 and PATH. I'm thinking we don't do a lot of the community prevention or education about suicide. If some funds, a limited number of funds could be put toward education and helping people know what to do and recognize and help people get there before we have to call the police for a check and a safety check and all of that stuff. So suicide was one of them for me.
Now, ending the silence, I'm sure you're aware, ending the silence, that's such a good, it is the suicide prevention education piece. And of course, Project Oz has really committed to getting that out into the schools. And of course, that was a little more challenging this year with the schools, but I know Colleen, the wonderful person that heads that up, made sure that could be virtual. And so I know Colleen also does presentations other than school age people. I mean, I know she's gone to senior centers and other places, but are you thinking, those of you that know Ending the Silence, Faye, would that be a program that if we could expand that would help meet that need, do you think?
I think that would, but also how do we address the general public outside of schools?
Yeah,
So
that's what I meant. Though. If we could expand that and get it to more
Yeah.
people, I mean, do you think that's a good tool to do that?
I think it would be.
Okay. And she did a behavioral health forum, didn't she, Tricia? Yeah.
Mm-hmm.
She did, and it is actually out on the BHCC YouTube page. And so all of the forum sessions that have existed so far have been recorded and they're out there. And we do try to push it out on social media. And unless I'm wrong, maybe we've already, on March 18th, we do actually have a presentation on suicide prevention, which is being presented by Kevin Richardson with PATH. And so we were intentional to make sure that we had one that was specific to sort of general suicide prevention, and it was beyond and in addition to Ending the Silence. Colleen O'Connor and Neil Iden not only did Ending the Silence as a forum session, but they also did Ending the Silence for Families, which is more geared toward the adults in the lives of adolescents and how they can have conversations and what they can look for. But then in about 3 weeks or so, Kevin is going to present on suicide prevention. So we have some of that, and we can, both before and after, we can actually push some of those out a little bit more heavily. And so at least on forum sessions, we're trying. I agree that I think suicide prevention as a whole is really important. And I think will continue to become more so, because the thought that keeps resonating in my mind with regard to the homelessness and evictions is, I think we as a community also have to recognize that we are likely to experience a massive surge in homelessness within a short period of time. Because once that moratorium is lifted, then all of these landlords who have been holding off for all of this time can then file the paperwork to do the eviction. And so we're potentially facing, I mean, I wouldn't know a number to even guess, but all of these people are potentially facing homelessness in similar windows. And so how are we going to potentially address a huge influx of homelessness?
And is that homeless collaborative that's kind of funneling through United Way and others, are they looking at planning? I mean, are they mostly just meeting existing needs, or are they also trying to do larger scale planning for the community? Do you know?
I don't know. I mean, I can certainly reach out to Kathleen and David and ask, but I don't know what their plan, both short term and long term, is.
And
but
again,
I
is
can ask.
that something cities get involved with? I mean, would Bloomington normal town councils be interested in, part of that solution finding piece? And, again, that's one of those, who are all the collaborators that should come together to.
Right. I think at the very least, the townships, both Bloomington and Normal Township, have some separate funds that assist people as they need things. And then there were also some CDBG dollars that I think, and so don't quote me on this, I think some of it went back to address some of this need. But I'm not positive of the full extent or what the parameters were around it. But I can certainly, at least as a starting point, reach out to Kathleen Lorenz and David Taylor about where United Way
Great.
is kind of headed with that.
Great, thank you, thank you, thank you. Okay, we're going to give you a big to-do list, it sounds like, Tricia, but we all, yeah, so thank you.
Corey, this is Rick.
Yes, yes,
I
go ahead, Rick.
wondered on our agenda there, are we on like one?
We're kind of still on one, believe it or not. We're still
Okay.
kind of identifying
Well,
needs, so yeah.
If
we
it's
might-
okay, I had a couple comments. I just wanted to share.
Great, great, great.
Sitting and hearing some of this, I mean, and to Faye's comments, just from what I've seen and what I've heard and what our staff has seen is when it comes to the suicides, it's kind of across the board. It's not young, it's not old, it's across the board. And it's typically the things that you see where, and I'm only getting a small glimpse, but when we get that small glimpse into some of their rationale or their reasoning, they seem to be things that are certainly solvable, but they, for whatever reason, have chosen, they don't think they think they're insurmountable. And I can't help but think that that's probably some less access given COVID to some of those resources. So, that's hopefully something that can change. But again, that's sad. And I just wanted to hit on two other things. I mean, we've talked a lot about, social service agencies or the, or access. I'm just going to tell you the youth and the old are the ones that they have been hit hard by this COVID from what we've seen. I will start with the elderly. And I'm not just talking the nursing home facilities. I mean, I'm talking the isolation. I'm talking the depression. I'm talking the lack of ability to reach out because sometimes they don't know. I've got an 89-year-old mom who I'm engaged in her life every day, and she is scared and she doesn't know on some of these things. And I'm amazed at how many people I run into that don't have a support network.
Right.
So, I mean, we talk about these kids that are out there that don't have a support network or 20s and 30s and 40 something that don't have a support network. Somebody who's in their 80s and 90s and has limited means and does not have a support network has got to be terrifying. And we need to find a way to provide or better seek those out. Sometimes from our standpoint, I mean, we see more people aging in place, right? They're kind of fixed incomes. They have homes that they maybe can't take care of or a rental situation, but they stay there. And sometimes we don't hear about them until a neighbor tells us, or we get a call to a particular location and realize, wow, there's either some mental health issues, there's some care issues, there's some things like that, but we've got a lot more people that are aging in place. And so, like I said, that's a travesty on what COVID has done to that generation. Breaks my heart. And then on the youth, I mean, the whole equity in the schools and back and forth and access for some of the kids. And I'm primarily talking, elementary, junior high, high school, that stage. But, we found over the last, 9 months now or 6 months or whatever in dealing with this, our school resource officers have become a lot more outreach. They're working with when they're not in school, they're doing home visits just with administrators because there's some kids that haven't checked in. They don't know. It's almost like they've fallen off the grid. And if you've got them in the classroom every day and you can try and impact those kids, there's maybe a chance. But when they're unplugged, and if they don't have a good support group or network at home, then they're severely at risk there too. So that's what we've seen is certainly having to be more engaged in youth, more engaged with the seniors. And so those are just a couple that I just wanted to comment on.
Thank you, very well articulated. I really appreciate that. Yeah, those are huge issues. And I have to give a real shout out to school resource officers because I attended a training with some of them not too long ago, and to listen to their stories and their deep commitment and passion for just being that bridge and just, being that relationship. They were amazing. And that's a really unsung resource we have in this community of very dedicated people. So.
And I appreciate that. And just to share one other little anecdote with that is that there's a lot of discussions that come up from time to time about defunding school resource officers, pulling them out of the schools. And I can just tell you that it's probably been 10 years ago now because I was still an assistant chief at the time, and there was a statewide group that approached us because of the schools to prison pipeline And they were wanting to pull school resource officers out of the school back then. And they were talking about the arrests and all those kind of things. And so it was an urgency, right? We had to pull all of our data together. They wanted all of our data. They had FOIAs and they filed everything. And so we provided it, and they'd set up meetings. And once they got the data, they called us back and said, we're going a different direction. Because McLean County, anyway, did not show what they thought it would show. We weren't pulling kids out of school. We weren't doing those things. You know, it wasn't at the level that this group thought they were, so they ended up moving on. So, and if anybody has, I mean, you know, we could certainly have individuals that have questions talk with our school resource officers. I mean, they're the ones that tell the best stories and tell their story the best about how they engage, you know, between them and the school administrators. They really work as a team out there, and they treat the schools as you know, their community policing philosophy. They just treat the school as their community. So
Yeah.
thank you.
Yeah, they really are. In many ways, they're social worker, case workers. I mean, that's really, they wear that hat for sure. But anyway, so back to, having both of those entities, we certainly need to look at. And again, I'm hopeful that the District 87 grant, because that whole grant is about bringing the community to create, you know, these super structures around youth. I'm hoping that can help, you know, get some of these things lined up when they get started on moving that forward. But as far as the seniors, I mean, I know that's something, I mean, the two big agencies that support that are obviously ARC and then the Area Center on Aging. And again, I don't know, I know people have talked a lot about seniors during this time, and certainly the whole vaccination sign-up process has really highlighted the frustrations of seniors. So again, I'm not sure who's collaborating around that, but we know that those two entities would have to be big players in that.
This is Gabby. I just kind of wanted to give my, I guess, observation with the whole thing. I mean, we talked about some equity issues. So I mean, we talked in depth about the homeless population, but the way that I kind of look at it is kind of from a military perspective. It's like the people that are the frontline workers, the essential workers, the people that are out here, whether they're the homeless staff or the homeless clients to the grocery store workers, they're on deployment. And when you go on deployment, you're going to get all your shots. You're going to get your vaccines. You're going to get what you need in order to fulfill your mission. But what I've been seeing, as far as, you know, I don't know, you've got some hospital workers that are in category 1A, but they're working from home doing, you know, hospital billing and coding, but they're getting their vaccines. There's other people that have that luxury of working from home and, you know, they're getting those things. So I think we could probably use the Chamber of Commerce or Economic Development Council to identify the infrastructures and the places that are out there on the front lines that are being deployed. And then as far as like the vaccine signups for the elderly, instead of right now, it's kind of a free for all and everybody's fending for themselves. I helped a friend's elderly dad sign up, and we kind of had a heads up of the site on McLean County coming up. And we waited an hour and a minute, it popped up. We were signing up. I managed to get him signed up, but 5 minutes later, my coworker that I told about so he could sign up his mom was not able to do it. So if we identify places like Phoenix Towers, Lincoln Towers, these assisted living facilities, that's like those sites, let's just get mobile units out there, vaccinate the whole population. So maybe you'd also end the isolation because maybe now they can see their neighbor that they would normally see. So that's kind of my 2 cents on that.
Thank you. And I don't want to, and thank you. That's everything you said is very important, but I don't want to go too far deep into the vaccination process because that because I want to stay on the behavioral health, but I get your point that all of this stuff is kind of integrated. But I do want to make the point that the health department, I know, is working really hard to start doing mobile and targeted clinics in certain places. And they do have one set up, for example, at Mount Pisgah to do, target Black older residents. And that they're planning, I mean, they want to do lots of those, but until they have a steady supply of vaccine coming in, they can't do it. So we're hoping that, now that we're past the bad weather, which delayed shipments, that now maybe we can start getting a more steady supply and they can start doing more of these, like you're saying, outreach efforts. And I do think that's hugely important, and they very much want to do that. So anyway, but thank you for that. And Chamber of Commerce and Economic Development Council are definitely good collaborators that we need to bring to the table on any of this that we talk about. So thank you for that. Any other issues? We've identified some huge ones and clearly important ones.
I'm curious, and maybe Mary could ask this of Prairie Legal or maybe Dan, you may know something about this, being an attorney. I'm wondering when the moratorium is lifted, if there aren't discussions happening at the state or the federal level about really what that's supposed to look like, because that's something that's going to affect every state, every community. And it's hard for me to imagine a scenario where, especially under this Congress or president, that it's going to be like, all right, you're done now, and free for all, everybody out on the street. I would think have to be some kind of transitional structure, I don't know what else to call it, where, that be put in place, or if there isn't, could we advocate for something or, have something like that locally? Because I just can't imagine millions and millions of people all at once being thrown out on the street. It doesn't seem realistic after trying to support people after this 1.5 to 2 year period.
No, I'm not familiar with anything that is in the works once the moratorium is lifted. I mean, just my opinion is, number one, the landlords will take a look going forward and seeing who's been paying some rent and who's agreed to pay in the future and might be lenient. But I don't think there's a mechanism to give a lot of money to the landlords or to keep the landlords from evicting somebody. Hopefully, the economy will start coming back, but I don't think there's anything in place, and they've just kicked the can down the road. I don't think there's been anything as far as forgiveness of past rent or anything like that. And I would hope a lot of the landlords would take a look at the good faith efforts of some of the persons to pay and what's been coming their way. I mean, from the landlord's perspective, also, they should want cash rather than the right for an eviction. All along in my career, when I used to do evictions and stuff like that, I considered the tenancy of the apartment and the cash flow to be worth a lot more than the legal rights, including the judgment. So hopefully some landlords will realize that they're not going to allocate an entire courtroom or courtrooms just to hear forcible eviction cases. They'll just have a partial schedule, and it might take another 6 to 12 months to go through the backlog. So hopefully that will allow some leniency.
I think it also assumes that, as a landlord, that if I throw somebody out today, there's going to be somebody I think you were talking about this about tenancy, but that I can fill that spot immediately. And I don't know that that's going to be true in whatever the economy looks like going forward for that type of a rental.
Mm-hmm. Okay.
Yeah, I don't know of anything either, but I can certainly check in with Prairie State Legal and see if they could give any direction that they've heard or that the state is taking, and I'll get that back to you.
Okay, thank you, Mary. That takes us right next to, let's look at number 2, and that is to address the needs that we've just identified. And I think there are 3 big ones. We said, homeless issues, suicide issues, with maybe particular attention to seniors and youth, and then transition or reintegration from jail to community. And if we look at what would success look like, and again, for us, I think success is maybe too strong. It's like, what would forward movement look like? What should be some of those first steps to, but what should we be aiming for homeless? And what I just heard Lori and Mary talk about. So what would success look like or movement look like? Well, number one, beginning to have conversations with Prairie Legal and whatever the landlord association is, to, begin discussions on how can that be some sort of a leveled response when the moratorium lifts, so it isn't just goes from absolutely everybody's cut off and there's no graduation there. So does that make sense? That figuring out, is there some way to graduate that response? And is there some way to start looking at what are the numbers we might be talking about? And again, and looking at that homeless alliance that's already pulled themselves together, those 6 agencies or so, and what are they thinking in terms of what do they even have to offer? Other ideas? Let's stay on homelessness for right now. What are some other ways we would measure movement or measure getting started on this process?
I think that the measurement is massive in terms of everything we've talked about today touches every aspect of life.
Right.
So I'm thinking my friend has befriended a young woman and her little boys, and this woman, works 2 part-time jobs and has 2 little kids, and things like she's been trying to pay her car payment with each paycheck. So, but then that means that at some point in the month she's behind, but she thought she was doing fine and she was feeling really good about keeping up on things. And then she got this enormous thing from one of those, borrow money here places, that she owed $1,100 because she had fallen behind on each one of those months, and they kept adding up, but they didn't tell her. So it's like everything, the stress level on these individuals.
Mm-hmm.
How do you measure it's being gone? Is it kids are doing better in school? Is we have less suicides? We have less petty crime? We have less people shooting each other in neighborhoods? Like, how do we measure that? But I think it's almost global in the sense of it touches every part of our community.
Right.
And boy, I don't know, how would you sit down and say,
Right.
Oh, we're doing well?
Well, and you're right, because there's the mega outcomes, which is the community getting healthier based on some metrics. But for right today, I'm just thinking, what is even like a first step movement towards some of these issues? And it does seem like a first step issue is, are the groups that have some power, some mission related to homelessness, how are they working together with landlords to start, like you're saying, can we try to quickly have some ideas from those groups, rather than just let all of a sudden the moratorium happen and we watch the bodies pile up. And I'm guessing some of those conversations may well be going on, but it would be good if we knew that for sure. And again, Tricia, I keep throwing it back to you. Is that something BHCC would have a handle on? Is there conversations that we know about within the county that those homeless questions might be being raised?
Well, so there are different groups. That's the hard part. And there are a lot of people who sit on multiple groups.
Right, right.
There's a weekly COC meeting, the Continuum of Care through PATH. And so that's a group that is meeting on a weekly basis to talk about the needs of current homeless individuals, and shelter capacity, and what are the issues facing all of that. There are then 2 housing groups that are overseen by the Regional Planning Commission. There is a staff planning group, which is myself, representatives from the city and the town, Bloomington Housing Authority, Regional Planning. That might be it for the staff one. But then there's a larger affordable housing committee that we all are also a part of, and also includes agencies like Mid-Central Community Action and Prairie State Legal Services. And so there are a lot of groups that are touching on all of this. One having particular oversight. I mean, this is where I would almost say, like, PATH is regularly the go-to resource for a lot of it, in part because they have the connection to all the other agencies and it starts to streamline things. Again, I mean, like, I'll reach out to United Way to see like what their process is like, and that may shed additional light on, are there better ways to link some of those groups? Should there be some more overlap in some way? And so I think it's at least a starting point. But I echo the, how do you start to narrow it down when everything is so interconnected and it's such a big issue too.
Corey, I was thinking maybe it's really the progress that this group makes. We're not trying to measure the world's progress, but you know, what progress are we making toward getting the information, at least starting to get information and seeing if there's a place for us even to realistically interject ourselves. I mean, I was initially brought this up from thinking about the mental health services that might need to be available to people dealing with homelessness, not necessarily us trying to solve homelessness, but I think we would have a point of contact there somehow.
Yeah, very good. Yeah, I think that's it. Just we need to, I think we have success when we know the work is, you know, the collaborations have begun to do the strategic thinking about solutions, and you're right. And then where do we interject mental health supports into that? But part of it is you got to know where the people are, and they got to be stable in one place long enough to get there, or figure out how to help them get to the ones. And so you're right. It really is all about, you know, finding them as well, and doing that, being able to do that over time. So thank you, Tricia. Again, we appreciate your effort. So it is good. I mean, the good thing to know is that there are groups that are already obviously actively addressing this. And so, and I'm sure they are very aware of the urgency of this need. So, but it would be great to have, if you could share with us what you find out. And again, is there a place for behavioral health supports within that? Okay, so that's housing. Let's talk about the suicide piece. And again, I think one way we would know where we've made some impact is, again, Tricia's already got that. You know, it sounds like well covered by presentations, educational presentations, which also link to resources in the Behavioral Health Forum. And so if those are now, we know, in available formats, you know, can we just make sure that we all, through all of our connections and associations, that we are getting those links out to everybody and anyone? And, you know, again, are we sure that Area Center on Aging, are we sure that the ARC Center, are we sure that they know how to access those suicide supports? And so again, maybe that's the way we do it. Are we making sure that stuff that fortunately we have available or will soon have available, is it getting into the right hands and being driven deep into the community? Does that make sense for at least a start on the suicide piece, to make sure that people do have the education and the resource links? Anything else on that?
It does. I would maybe add to you mentioned ARC and the area agency. Yeah. but also we have a couple of programs that go directly out to the homes of the elderly. It's a home visitor program. The name is escaping me at that second.
Is that through the
Um,
Y? Is that through the Y? No, but the
No.
Y's got a program too, don't
That's another
they?
one.
Faith in Action, is
Faith
it?
in Action. Faith in Action, thank you. And then the two populations that I think maybe Rick earlier was referring to even more, the real isolated in our senior housing programs
Yes.
that we have, that we include those in that grouping that you were putting together for where our elderly are.
Yeah. And no, I know, Mary, I think even in our minutes from September 25th, Mary, you had mentioned, that some of those senior congregate living centers have case workers, for lack of a better word. So